Well, one of the most serious and tragic childbirth injuries is obstetric fistula. It's a condition that leaves women incontinent and often socially isolated. Experts say it is preventable and treatable, yet thousands of women, especially in low-income and rural communities, continue to suffer in silence due to lack of access to timely medical care. The United Nations and global health advocates are calling for increased investment in maternal health, expanded access to emergency obstetric services, and more awareness to eliminate the condition. Here in Nigeria, where cases remain high, interest groups are asking the government to strengthen health systems, train more skilled birth attendants, and prioritize rural healthcare infrastructure. Well, let's talk about how to combat the issue of obstetrics fistula in Africa and narrowing it down to Nigeria. Occupational health specialist Victoria Amu is live for us now. Thank you very much for joining us. And talking about building a level of awareness, especially at the rural areas where we see these indices the most. What are your thoughts on as to how far we have gone as a nation to beat the numbers?
Thank you very much. I'm an occupational therapist. I'm Dr. Victoria. I'm an occupational therapist. Oh. The awareness is very low. And because the awareness is very low, that's why Nigeria has over 12 million sufferers of the VVF. People are not yet where they understand that when you give a child out at a very young age, you cause more problems for the child, maternal child for the child, and the child might not even survive it. Most people who have VVFs are people who are married out at very young age, especially in developing countries like Nigeria. In countries that are developed, they don't have that issue of women coming down with VVF. VVF is a hole that is in between the bladder and the vagina. That means that when there is water, when there is fluid in the bladder starts to leak into the vagina. And what do we get as a result of that? The person itself, there's stench around the person all the time. It's uncontrollable. What are the common causes of it? The causes are early pregnancy for young women and prolonged labor. That is synonymous in Nigeria. Somebody wants to go and have a child. The doctor will say this child needs to be had through cesarean section. The parents will take the child to the church and have the pastor praying that no, it's C-section. It is a normal birth that this child must have, this mother must have. And what do we see in the end? The child, this prolonged this thing, we see VVF in the end. What are the things that you say? It's continuous uncontrollable leakage of urine, it's foul smell and discharge, there's recurrent urinary tract infection, there's social stigmatization. As an occupational therapist, we look at the social stigmatization and how these patients can cope with that. There's isolation, there's depression, because if your husband comes into a room and there's stench all over the room, what is the next thing they do? They all hold their nose and they all go back, you know? So there is skin infection, there's genital sores, you know? Most of the girls, because there's leaking uncontrollable, there's no amount of control, there's no dryness in the vagina for those kind of women. Nigeria counts for over 40% of this globally. Nigeria counts for over 40%. There are approximately 12,000 to 20,000 new cases annually in the north. There is in the north because they have early brides at 13, 10, 12. There is in cases of girls who got raped by their siblings, by their incest, by neighbors and all of that. And there is in the areas of Borno State, In the areas of, yes, there is in Borno State, there is also is in the southeast,
right.
Ebonyi State,
Right.
Akwa Ibom, where they give their children out as house help and get raped in the house. So what do we do as a nation to increase awareness? Edo State is doing something right now. Edo State has been able to give 23 acres of land.
Right, because I was about asking what sense of commitment you are getting from authorities to combat this health matter, this health emergency, or would it be right to call it that, and what needs to be done? Quickly, please.
First of all, now, the federal government have been able to keep Edo State as the state that will anchor this VVF issue. The state governor, the present state governor, has given up 23 acres of land, or 24 acres of land, for a VVF center. The former governor of the state, that's Obaseki, was a pioneer in it, but he didn't do much, you know. So the present governor went as far as giving the land, went as far as making the environment, making it possible for the center to exist. That means hiring hands that would actually, because there is need for surgery for these women. It's only surgery that is a corrective measure. There's need for therapy, occupational therapy, hugely for these women. There is need for all of those social support to take care of depression, to take care of stigmatization, to help them into the workforce. Because you won't hire somebody that stands up your place.
Dr. Amo,
Edo State government is doing a lot right now.
Right. Thanks a lot, Victoria Amo, for your contributions.
You're welcome.